I had a really interesting consultation yesterday. Now, a patient came in because she was referred to us by one of her friends. Just like her friend, she was told she had neuropathy. Now, her friend that came to us before, she went to a couple clinics, didn't really get great results, was super frustrated, finally ended up with us and did really well. So she made the referral. Now, the new patient comes in and says, hey, you saw my friend, and my story is basically the same as hers. Now, I believe she already went to two other clinics. One of them, she did stem cells, didn't really get great results, and they did some whole neuropathy protocol with vitamins and supplements, and she didn't really do well with that either. So now she comes into us, she's frustrated, but a little optimistic because she already knows somebody who went through our system and did really well. Now, quick history on the new patient. Years ago, I think it might have been a decade ago, she actually had a stroke. After the stroke, she lost feeling on one side of her body, and slowly it came back. But ultimately, she was told she has neuropathy. So she was seeking results or some kind of, better function for her life. Now, she comes to us, we do an evaluation, and through the evaluation, majority of her symptoms are all one-sided. So we figured out that maybe this is not peripheral neuropathy in a true sense, or at least not the kind that will respond well to our treatment. So we eventually send her out to physical therapy. Now, we work with a group of physical therapists that all they do is focus on patients who suffered a stroke, whether it's recently or a long time ago. So we know she's going to do well with them. But the point of the story is, just because the results worked for a friend of yours doesn't mean that exact same type of treatment is going to work for you. If you go online and someone says, hey, I take ALA, or I start taking a B complex, or I just got my diabetes under control, yeah, maybe that worked for them. That doesn't automatically mean that's exactly what you need. That's why proper testing, proper diagnostics are necessary. You may walk into a clinic and they specialize in some new technology. So every patient they see as a candidate for that technology. That's not always the case. Especially as a clinician, we have to know when to refer out and what our capacity to treat is. We have a saying in here, we don't really care where you get better as long as you get better. So for the patients out there, get proper testing done. Understand what's driving your neuropathy so you can have a treatment that's specifically directed at what you need, not what your friend got results with.